thank you for coming in to the doctor's today. My name's Tori, and I will be seeing you as my patient. So, today we're going to just make sure your eyes are properly working. This is not a regular eye exam. This is more just to see if your eyes have the proper reflexes that they should normally. So what we're going to use to check that is I'm going to use this flashlight. Now I'm going to shine it in different patterns and areas, and I'm going to tell you certain times to look at it and follow the light, and then other times to stare into the light, and I'm going to count, and then I want you to look away, and I want you to tell me if you see spots in your vision. But just to be aware, if you do stare into this specific light for a long period of time, it can damage your vision. So that's why anytime I'll ask you to look directly into the light, I will make sure that I count for a few seconds so you don't damage your vision. So I guess we're going to get started. This should be a painless procedure that I'll be doing today. So yeah, this is just a regular little flashlight, and before I get started, I just want to show you that it's harmless. It has this string where you can hook it on things. And then on the back, it's got this button. It makes this really great sound when you scratch it. And then on the other side, it's where the lights will shine. And if I hold it to an angle here, you can see the individual little light bulbs, or the little, it's not light bulbs, but it's the little areas where the light comes out. And on the outside, it has these textured lines. So it's easier to grip onto. So I guess we're gonna go ahead and get started. So I'm gonna gently push the button. Now the first exercise that we'll be doing is I want you to look straight ahead, and I'm actually going to use the end or the back of this pencil, and I'm going to show you where to look, and I'm basically just going to swipe the light across your face, and tell me if you have the urge to blink, or let me know if you do blink, which I'll pretty much catch that myself. So I have this, and I'm just going, and this is directly in the center of your face. Yeah, you blinked. Now when you blink, that is perfectly normal. That is showing that you do have the correct reflexes. Okay, good. So You do have the ability to reflex your eyes, which means your eyes know when to blink, which is very good. So now I'm going to do the exercise, which is where I'm going to just make you follow the light for about 2 to 3 minutes. And I want to see how long you can keep it up without being distracted, because a lot of people get distracted when they do this in my office, and usually after a certain point, if they're not distracted, we'll stop it anyway, because it doesn't need to go on forever. But as long as you can keep it up for 3 to 4 minutes, maybe even 5 minutes, that means you have really good, you can focus really well. And for your eyes, that can be good because it means your eyes are very alert to things. So I'm just going to move it around in, no specific areas of the face, and I just want you to follow the light. No, this part will not blind you because I'm actually moving the light, but if you were to stare directly in it for a long period of time and me keeping it still, that's when it would actually affect your vision. See, I notice when I have it shined right here, that's when you blink the most. Just keep following the light. And as you can see, I'm backing it up some and then pulling it closer. And that's just me doing it in all different directions to make sure not one specific exercise is working as well or not as well. You're doing very well. Very well. Okay, so you did very well with that specific procedure or exercise. So now we're going to do the last one, which is staring into the light. and I'm going to count to 3, and I'm going to do both eyes 3 times, and every time I flash it or have it in your eyes, I'm going to count to 3 like I just said, and I want you to look away to whatever is the opposite side of that eye, and I want you to tell me if you see spots in your vision, like little dots that maybe look like stars. And if you do, that's perfectly normal, and if you don't, that's not normal, but it's not really bad. So if you don't see the spots, we'll just send you to an eye specialist, but more likely you will, because it's very uncommon for you not to see the little spots. So I guess we're going to get started with your left eye, and I'm just going to shine it, and then I'm going to count to 3, and I'm going to do each eye 3 times, and each time counting to 3. So let's get started. 1, 2, 3. Now look to the side. Do you see spots on the wall? Good. So now I'm going to do it again. 1, 2, 3. Look to the wall. Good, you see spots? Okay. 1, 2, 3. Okay, good, you see spots. Now for your right eye. 1, 2, 3. Look to your left. You see spots? Good. 1, 2, 3. Look on the wall. Good. One more time. 1, 2, 3. Look on the wall. Good job. So you did very well with this eye procedure, making sure your eyes work normally or function properly. To actually get your eyes examined for like the vision part, we're gonna set you an appointment out for next week with Dr. Valentine, but you will have to fill the papers out for that appointment at the main desk once you leave this room. Yeah, I don't know why, but I love tapping on my miniature red flashlight. It's so relaxing. And scratching it. You like the sound as well? Yeah, a lot of patients tell me that they enjoy the sound of tapping. It's kind of a little habit I have, tapping on my flashlight. I've even had little kids tell me they enjoy it. They say it makes them get these little tingles in the back of their scalp. I've never heard of that before. So, yeah, thanks for coming in. I hope you enjoyed me doing this, and I hope this was kind of relaxing, even though it is a doctor's appointment. But I find doctor's appointments very relaxing if I know I'm not going because I'm sick, because that's never fun. So, yeah, I would love you to come back, whenever, and I will, give you any other procedure that you would like. So, yeah, come back as soon as possible for your next appointment. Bye!